We're going to start out today with the announcement of a very generous donation by Dr. Raj Vedakudi and the Vedakudi Foundation, a well-known name in Detroit medical circles. And Dr. Vedakudi has donated $400,000 to let us continue our work among the senior citizens. The 200 deaths that we have experienced at the nursing homes have been very painful for all of us, but we have 100 other facilities, adult foster care centers, assisted living facilities, senior citizen housing, where while we don't have the same indications of infection, we have the same vulnerable population. And we are very anxious to move through those 100 buildings and test all these individuals. And when Dr. Vedakudi heard about this, he stepped forward, and along with his partners at Henry Ford Health System, and John Zervos is here, who's head of the Global Health Initiative for Henry Ford, they said they would work together. And what John and his team have been doing, with some guidance from Dr. Mark Zervos, is they've been driving a lot of the testing that happened at the nursing homes, which was then taken to our 15-minute Abbott sites. They're now going to dramatically expand that operation. Between Henry Ford and Dr. Vedakudi, the seniors in the city of Detroit are going to be that much safer. With that, I just want to say thank you, and by the wonders of technology, Dr. Vedakudi is joining us here today. So, Doctor, thank you for this generous contribution.
Thank you, Mayor Duggan. It's very important to me personally. 45 years ago, I came to Detroit for my studies and career, and they've given me a lot of opportunities and build my career here. It's the least I can give it back and help the seniors, and it's very important initiative for us. And outreach and the testing and monitoring them in a while testing way is very important to us. So we're very excited. I mean, it's not going to stop here. I'll continue to do the support as we see more need is needed, and very committed to help Detroit's senior community, vulnerable population. Thanks for partnering with us, and we're looking forward to see some good results come out of this. Thank you so much.
Well, thank you, Doctor. These are the kinds of partnerships that are making a difference. And now I'm going to ask if your partner, John Zervos, would like to talk about how you are working together on this project.
Thank you, Mayor, and thank you to the Vedakudi family and, of course, to the Health Department. From the beginning, our team, the Global Health Initiative at Henry Ford, has connected with Denise and Dr. Rahman and Carla over at the Health Department, really to address an urgent need of getting to our elderly residents here in the city of Detroit. Some of that work underway already, and with additional partners as well from Wayne State University. Dr. Tina Chopra and Dr. Paul Kilgore over at Wayne State have been a part of this. The EMT department has been a part of this from the beginning, and of course our teams at the Health Department and Henry Ford as well. And it's really been a phenomenal partnership in terms of academic institutions, the city of Detroit, a major healthcare system, and now the philanthropic community really coming together to address such an urgent need in the city of Detroit. The program will extend beyond nursing homes, as the mayor indicated, to really any congregate settings in which elder Detroiters are residing, starting with the assisted living facilities here in the city of Detroit. The components include both testing of residents and staff within these congregate facilities, as well as outreach. And that outreach includes both needs assessments, in which so far the city has been a phenomenal partner on that. We identify needs within these settings, and we're able to address them. We also provide education on infection control, in addition to other topics which the staff really comes to us. So now that we have some continued support, some additional support from the Vedakudi family, we're able to bring this program to so many additional people within the city. And so we really thank you for the support, Mr. Vedakudi. Thank you.
Thank you.
All right, and thank you so much. We'll let the doctor get back to what he was doing, and we're going to let John get out to the senior centers and start testing. But thank you very much, sir, for your generosity. And we have